As we await a plan for the next school year from the state, many parents are having all kinds of questions on how to prepare their children in today's two-year well-being. We are talking with both medical and mental health experts about schooling during the pandemic. So who we have today, Cone Health's infectious disease specialist, Dr. Cynthia Snider, and clinical psychologist, Dr. David Gutterman, are both joining us until 6 o'clock. So Dr. Snider, let's first start with you. You say whether remote learning in the classroom or whether they go to school, it's important to get the back to school vaccines for children. What types of things do we need to keep top of mind?
So I think especially any child that's heading into kindergarten, you should definitely fulfill checking in with your pediatricians to see what vaccines are required to going back to school. I think measles, mumps, rubella is always key. And then also as we head into this winter, the flu vaccine, though it is not mandated by schools, it's highly recommended. And I think anything that we can do in order to keep our kids healthy and keep them in school in person is the best way to go. I think this past few months has been very disruptive to a childhood vaccine series, and so it's very important to get caught up if you've had a delay in your kids' vaccine series.
Okay, and that you don't want to get caught at the last minute trying to get all those vaccines up to date and that kind of thing if they are in fact headed back to school. Dr. Gutterman, how do you prepare your child mentally for this new school year? The end of last school year was hard enough. How do you prepare them for the beginning of this new one?
Well, that's a complicated question because, again, we don't know whether the kids are going back into the school setting or whether they're going to be, distance learning, from home. So if you're going back into the school setting, first and foremost, talk to your children, regardless of their age, about their feelings about it first. Before you impose your own feelings, do a gut check about how are you feeling about it yourself, first of all, because kids can pick up on our own feelings. And it's important to try to maintain a sense of calm, regardless of how anxious you might be about it. But talk to your children, find out how they're feeling about going back in. Each child will have a different experience depending upon what this period of time has been like for them. If there's been a loss in the family or a parent's been furloughed, it could have been a very, very stressful time. Some kids will be very excited about going back to school. So you check in with them, see how they're feeling, and make sure that along the way that you continually do that. You look for signs of any significant stress or anything like that. If you're going to be staying at home, there's obviously a great deal of disappointment that a lot of kids will be feeling. So once again, you talk about what that's going to be like, and we talk more about it if there are questions, but how do you manage creating an environment that's a good learning environment at home? That's vitally important as well, to make sure that the time is structured and try to keep a time that's going to be sort of consistent with what a school day would look like.
Yeah, and there might even be that whole thing of a kid might be scared to go back to school. So you would have to be talking about that too. There's all those different possibilities. All right, so Dr. Snider, what are the risks, health risks associated with COVID-19 among kids versus tweens and teens, and are they different?
So that's an excellent question. In the beginning of the reports of COVID-19, it was so predominantly focused on adults, and we didn't have that much description of what was happening among children and adolescents and young adults. We know that there's probably a fair amount of probably younger children that have mild to maybe incredibly no symptoms, so I think that is the challenge. This is still a respiratory viral infection, and so like fevers, kind of that body aches, sore throat, all those symptoms, as well as some GI symptoms such as diarrhea and vomiting, can exist as part of COVID-19 disease. The challenge is that as we start heading into the fall as well as winter, there is definitely an overlap with influenza that probably has that same clinical picture. And I think for the concern with when you go back to school, I think is all kids should, family members should definitely be aware of their children's, like how they're doing, their symptoms, you know, especially if they're sick with any like sore throat, and definitely fever or cough. That is a point where your kid should, you know, be assessed for their symptoms, but either by phoning in or doing a televisit with their pediatrician, but definitely probably not going to school because there is a risk of spreading whatever that respiratory illness can be. In terms of adolescents, I think what we worry about is there is this inflammatory kind of process that's called MISC that's a little bit more severe that has caused young kids to be hospitalized. Luckily, I think in North Carolina we've only had a handful, but that may increase as there are more cases of COVID-19 in the pediatric population.
Okay, so it is very different between those young children, between those teens as well. But the bottom line is if your child is having some kind of symptom, they should be looked at, or you should be calling the doctor.
Correct. I want to say that, you know, probably I would say some teenagers probably are closer to like what you would see in adults. However, in general, there's still so much to be learned about pediatric COVID-19. And I think the key thing though for the fall to keep your classroom and your community healthy is that if anybody in your, if your kids are sick, definitely keep them out of school and figure out how to assess them for how to make them better. And again, if somebody in the household is positive, there's a good chance that the other household members, including kids, can also contract COVID-19. And so health departments do recommend that everybody in the household get quarantines if one person is sick and doesn't attend school or work for the next 14 days.
Gotcha. Okay. So that's a lot to take in. It's a lot to process. That seems like a lot to handle. So Dr. Gutterman, do you have advice for parents as they are preparing for this next school year, especially with that in mind?
Well, I think it's important, as Dr. Snider said, to make sure that the kids also have an understanding. Just because they're going back to school, for example, doesn't mean that it's going to be like any other school year. This is going to be a different school year. And it's important to talk about those differences in advance to make sure that that the children have an understanding, regardless of their age, that it's important that they comply with whatever the guidelines are at the school. So the hand washing and masks and distancing are all just as important, even though they're going back to school. And kids need to understand, again, that every effort's going to be made to keep everyone safe, but there can be a lot of anxiety. We've all been so very careful, hopefully, during this period of time. And then going back to school, we need to instill that same sense of being careful so that we don't, spread the virus anywhere.
Okay, so the doctors will be here until 6 o'clock tonight answering your coronavirus questions, and this is how you get those questions answered. You text your question to 336-379-5775. Again, this is a text, not a call question. We'll be right back.